Well, joining us live right now, as I mentioned, my good friend and yours, Dr. Joe Congini, sports medicine at Akron Children's Hospital. And Joe, it's a cooler day today, and that's where you want to go with some cool, cold therapeutic relief, I guess.
Cold therapy, and talk about all the benefits of cold therapy. And all the people over at WAKR were saying, hey, would you please teach this to Ray Horner? Because we think that Ray could benefit from being involved in some of this cold therapy. People are talking about it at my office all the time. It's all the rage right now, Ray, and it's called, cold water therapy, the polar plunge. The cold plunge is really what it's written about. There's a lot of articles that have been written and a couple of research articles just scratching the surface about it. So I wanted to talk about it a little bit today. It's been around as a technique for a while for elite athletes. A lot of elite athletes or high-intensity workout athletes have done cold plunges where they get into cold water after their workouts and submerge their whole body into these cold water tanks and so forth. But now it's really gained a lot of popularity among amateur athletes, non-athletes, young athletes. I'm getting questions from parents all the time about it now. And I know I hate to be a broken record, but of course we need more research to prove some of the effectiveness that people are claiming about it. But, they're making claims that it's like life-changing treatment for them to be using cold plunge treatment. And so I wanted to talk a little bit about it. Generally, it is safe. These athletes immerse their body in cold water. The body heat changes, blood flow changes, supposedly have some significant benefits. The most recent article that was out was April 12th of 2024, this month, in the Journal of Sports Medicine. The number one thing, of course, is that it lowers the markers, it lowers the amount of muscle soreness or damage when you're into higher intensity workouts. That makes sense, and I think there is some research to talk about that, number one. Number two is a lot now being written about it reducing stress and anxiety and boosting mood for people that use cold plunge treatments. Number three, it reduces inflammation and pain in people that maybe have some soft tissue injuries or other injuries related to their workouts. And I think that probably has some pretty good proof in the literature. Number four, there's discussion of fat loss or weight loss. That one I don't think is as well explained and proven in research, but like we say all the time, we'll have to take a look at that. One of the others is that it is an immune system boost, that it boosts the immune system to be on a regular schedule of cold plunge therapy. Number six is that this one I found in a couple of other articles, in contrast with heat, in other words, you go from cold to heat, that it lowers the risk of dementia and Alzheimer's. That one I think needs to be studied a little bit more. Number seven, they talk about it boosting the heart and the circulation, and that by constricting the blood vessels and then opening the blood vessels back up, this actually can be helpful to the heart and circulation. So those are some of the benefits that people are talking about. But I also wanted to know and tell people a little about what are some of the guidelines. So the guidelines are really, it's most ideal to be in a temperature, most people do this outside, in a temperature of 55 to 70 degrees is the temperature outside, but the temperature of the water is 55 to 7. The temperature of it works best with a temperature of 50 to 60 degrees. Athletes should never, and people should never do this alone. Everywhere that I looked at, people talk about you should start slowly and ultimately work up to 15 to at the most 20-minute sessions, Ray. This is not the ultra-low low-temperature workouts that the NBA players and the highest-level athletes were working about, the sub-zero, where they get in for 2 to 4 minutes in those cooling units that they talk about. This is a different kind of thing with the cold plunge, where we are looking about working up to 15 minutes at 50 to 60 degrees or so. And one of the things, I'm going to keep mentioning it over and over again, start slow. Start at 30 seconds. Increase by 30-second increments. This is what's being recommended in the literature. In the literature, it's being recommended perhaps at most 3 days per week. What are some of the side effects or problems? Certainly hypothermia could be one. So be careful about not overcooling, and that's why doing this with somebody else. And there is discussion of vasovagal or arrhythmias being a part of the side effects, and that also is why this should not be done alone. Somebody else should be with you when you're doing the cold plunge therapy. But again, many people are reporting it in the literature, Ray, as being life-changing therapy as they've gotten started on it, and there sure is a lot of talk, a lot of articles, a lot of research being done about it, and I just wanted to at least bring out some of the basics about cold plunge or polar plunge treatments that a lot of people are doing around the country.
Joe, when you apply ice to our body, talk about that, because I was wondering if that also coordinates with the cold water plunge on more of a broad scale on what that does to the body from a sports medicine standpoint.
Yes, that's right, Ray. So this is an extension of using ice, of course, for certain injuries and things that we've seen, but this is also working all the way down to the core. Mm-hmm. So working from the standpoint of like constricting the blood vessels in the circulation part, and that's part of where the theories are that there is more benefit than just icing an elbow or an ankle from an injury. This gets down to the core of cooling all the way down to the core, and that's where some of these side effects of things like immune system boost or helping the circulation, and some of the other things, of course, reducing inflammation and pain, those kinds of things make sense going back to what you said about icing an area where there's injuries. But this is all the way down to the core, and especially from the standpoint of the circulation and constricting the blood vessels. That's some of the core of how this benefits people.
All right, Joe, great information, and certainly food for thought as well. As you mentioned, it's a rage right now. Make sure, Joe, wouldn't you recommend that before maybe someone goes to do this, to maybe sit down and talk with a doctor, maybe of sports medicine and such, before you go ahead and go down this road?
It's absolutely a great point. And so certainly there could be some underlying medical issues that certain people would have where this would not be a good idea for them. So just like you would discuss with your doctor about any form of treatment program that you're undertaking, I think if you're going to undertake cold plunge therapy, it makes perfect sense to have an appointment with your doctor and discuss whether you are a candidate for this or not. And we also have some concern because there isn't as much study in younger people. And I'm hearing this in younger people too, Ray, even before teenage years. And that is something where I definitely think discussions with medical people is a very good idea.
Great stuff, Joe. Thank you so much for the time and really the research into something. And like you said, a lot of people talking about it. Joe's kind of laid it out there for you, but you heard what he said there. Make sure you sit down and talk with your doctor before you go down this road. Joe, as always, my friend, thank you for carving out the minutes in your busy morning, and we'll do it again next week.
Thanks, Ray. Have a great week.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, joining us live this morning.